Hello everyone. Thank you for standing by and welcome to the Pregnancy 101 First Trimester webinar, sponsored by IsisParenting and presented by Dr. Laura Riley. My name is Chris Just and I'm a certified nurse midwife and the Executive Director of Prenatal Education here at ISIS, and I'll be your moderator this evening. I'm also joined by Nancy Holtzman, nurse, lactation consultant, and our VP of Clinical Content. She will be in the chat room. During the presentation, all participants will be in a listen-only mode. However, you may submit questions to the speaker at any time by typing them through the chat feature located to the left of your screen, or direct your questions to us on Twitter using our handle at ISIS_parenting. We'll also take questions at the end of the presentation. Today's webinar is being recorded, and all of you will receive a link to the recording early next week. So if you missed something or need to step away for any reason, that's okay. IsisParenting is proud to host this evening's webinar. ISIS is the nation's most trusted prenatal and early parenting destination. We provide innovative programs and a highly edited selection of products for expecting and new families in our 4 Boston area centers and online at IsisParenting.com. As I mentioned, I'm Chris Just and I'll be your moderator tonight. And now, it is my pleasure to introduce our presenter for this evening, Dr. Laura Riley. Dr. Riley is author of You and Your Baby, Pregnancy, and we have this book available at our ISIS centers. She's also the medical director of labor and delivery at Massachusetts General Hospital and dedicated mother of 2 daughters. She's also Associate Professor of Obstetrics, Gynecology, and Reproductive Biology at Harvard Medical School. For more than 20 years, Dr. Riley has been committed to serving pregnant women. At Boston City Hospital, she focused on high-risk pregnant women with an emphasis on HIV. In 1995, she joined Massachusetts General Hospital, where she currently practices caring for women with high-risk pregnancies. Her research and publications in peer-reviewed scientific journals focus on HIV and pregnancy, immunization practices in obstetrics and gynecology, and the association of epidural analgesia and fever. Her administrative interests have led her to also focus on quality and efficiency of obstetric care. Welcome, Dr. Riley.
Thank you very much. It's a pleasure to be with all of you tonight. So I'm going to try and take a quick journey through the beginning of pregnancy, and hopefully everybody has lots of energy, although I know that in the first trimester of pregnancy lots of people are taking naps. So as Chris said, if you miss anything, you can always listen to this later when you're feeling better. So as you're thinking about becoming pregnant, if you're not already there, it's really important to think about these questions. So if you have any medical problems or you take any medications other than sort of the occasional Tylenol, or you're overweight or severely underweight, or there are any genetic problems that you're aware of in your family, if any of those things trigger a, ooh, I'm not sure, or a yes response, then it's really helpful for you to get a preconception visit. And you might say, well, you know, I don't have time, or I'm not sure who to go to. So if it's time that you're concerned about, actually that visit can be really quick, and it really depends on you just writing down your questions and going in and asking a provider very specific questions, and it won't use up a lot of time. In terms of which provider, it really depends on the extent of the problem that you have. So if you have a medical problem, you might want to see a high-risk obstetrician who can sort of go through how pregnancy will affect your medical problem or how your medical problem may affect pregnancy. If it's a genetic problem that you're concerned about, you might want to call the hospital and see if you can see a genetics person, or you can try a high-risk obstetrician also. And then some of the other more mundane things, like which medications you can use, and maybe if it's weight, which is really a common one, you could just see your general OBGYN or your nurse midwife prior to pregnancy, but it is worth asking the question. So assuming you are pregnant, what's your due date? That's what everybody wants to know. So your due date for our purposes is based on your last menstrual period, if you know it, and some women do write it down. Others of us, me included, never write that kind of stuff down, so it's a bit of a guess. But if you've guessed, that's okay. We use that last menstrual period, and then we calculate. Usually most of us still use the little wheel, and you can also do it. You can also plug it in online, and it'll just pop up. So for your expected due date is, by calculation, 40 weeks gestation, although full term is any time after 37 weeks. And just remember the due date that pops up for you, whatever that due date is, it really is about plus or minus 2 weeks. It's very uncommon for babies to come on the due date. Only about 3 to 4% of babies are actually born on that day. Most people will have a confirmation of their due date. Some will have a confirmation based on ultrasound, and others will have the confirmation made when they go for their first prenatal visit. If you have multiple ultrasounds, I think it's always important to note that the earliest ultrasound you have, so the one that's done at 6 weeks or 8 weeks or 10 weeks, is more accurate than the one you have later in pregnancy. So we usually take the due date based on your last menstrual period and then confirm it with your ultrasound, that earliest ultrasound, and then we say that's your due date. The other piece of information that's really helpful for you to have is breaking up pregnancy into what we call trimesters. What I've written on the slide is that usually the first trimester is 1 through 12 completed weeks. The second trimester is 13 through 24, and the third trimester may start at 25 weeks and beyond. You'll see in different books, in different pregnancy books, that may vary by a week or two, but that's the general gist of it. And then again, full term is any time after 37 and 0/7 weeks. And then just one plug, this is my favorite. It's very helpful to your provider, whoever that person is, if you refer to your pregnancy in weeks. So my favorite is when patients will call on the phone and say, I'm 7 months. That's really difficult for us to know what 7 months is. That could be 28 weeks. You could be talking 26 weeks. You could be talking 30 weeks even. And the implications of what you're saying to us over the phone are very different based on the gestational age. So it's helpful if you use those weeks. So the early pregnancy feelings, this is just a few of them. There are lots. But I think many women will say that they have cramping, which is unnerving. The cramping is really a sign that your uterus is growing, and that's okay. The cramping can be quite intense at weeks 5, 6, 7. As long as you're not bleeding, the cramping is okay. Bloating is really common, and this woman has a water bottle. I don't even think those are in existence anymore. But at any rate, bloating is common, especially at the end of the day. You'll notice that with pregnancy, certainly in the beginning, the high hormone levels, the high progesterone and estrogen levels do affect how easily your gut moves. And when it doesn't move very much, you get constipated and you feel bloated, particularly at the end of the day. Fatigue is extremely common. It's one of the hormonal changes of pregnancy. Women will describe themselves as saying, oh my gosh, at the end of the day, 3, 4 o'clock, I just need to put my head down. If you have the luxury of being able to put your head down, go ahead. It's better to put your head down and take that quick nap than it is to go after caffeine. It's not going to help you in the end, and it's probably not in your best interest anyway. I mentioned the constipation. Food aversions, those are really common. A lot of women can't stand certain smells, or foods that used to be favored foods just are not appetizing in the beginning of pregnancy. The good news is those food aversions generally get better with time, and probably by 14 or 15 weeks you can eat whatever you want. Queasiness is another one that's extremely common. I like to focus on queasiness because I think probably 75% of women will have some sort of nausea-type feeling at some point during the day. It's not always morning sickness. It can happen at night. The issue there is that the good news is again, this is something that doesn't usually last. So, and some women will have more than queasiness. Some women will have nausea and vomiting. The women who have persistent vomiting, that's actually a very small percentage of people. It's the people you hear about, but in general, don't feel like just because you're queasy, you're going to definitely have the vomiting aspect of it. It may actually never get worse than that. And then I have these little stars because my next slide has a bunch of different remedies that I truly believe in. Urinary frequency is another common favorite of early pregnancy, and that happens because your bladder is just in front of the uterus. And as the uterus gets larger, it presses on your bladder. And so your bladder really can't hold as much urine as usual, and you have that sense that you need to go. In addition, we're also sort of suggesting to you that you drink lots and lots of water. So a lot of women are going to the bathroom frequently because they're keeping themselves well hydrated, which is a good thing. And then this final thing I have on the slide is breathlessness, which is also common. Women sometimes say, oh, I'm so short of breath and I've only climbed a flight of stairs. Again, that's something that you do see even in early pregnancy. It's much more common later in pregnancy, but the breathlessness does come early in pregnancy. Again, it's a hormonal issue related to progesterone effect on your lungs. So because the queasiness is such a major issue, this is sort of queasiness by Riley. So I've been doing this a really long time, and I put this to use in my own 2 pregnancies. One thing that I've learned actually from a nutritionist friend is that it's really important to sort of sip on fluids, because if you gulp the fluids, you gulp not only too much water or whatever you're drinking, but you also gulp a lot of air. And the air makes you feel even more nauseous and sort of more queasy. The other thing is that this is counterintuitive for most people. Just put the water bottle down. It's amazing how water makes you feel sick when you're already sick. So I suggest that the best way of getting the hydration, which you absolutely need, is by adding lots of ice to whatever you're drinking. So take a little ginger ale, let the fizz out, swish it around, let the fizz out, put it on a ton of ice, and then drink that down. Or take some juice and then water it down with tons of ice. And that way you're getting lots of hydration, but you're not getting it with pure water. It's amazing how some women just, the straight water just doesn't work. It makes them feel more nauseous. Some women will do better if they use a little seltzer water again. In terms of ginger, ginger's known to cut nausea. It's a good form to try, as well as ginger tea. When you're doing the ginger tea, though, you don't want it to be really strong. You literally want to drop the tea bag in there and let it turn a little bit of color and then take it right out. And then my all-time favorite, which I feel like I spent a fair amount of my pregnancies using lemonade and lemon drops, lemon popsicles. Lemon definitely cuts nausea. And then again, lemonade with lots of ice, lemon popsicles, lemon Italian ice, all of that will give you lots of nutrition as well as cut the nausea at the same time. And then another one of my favorites is if you're going to snack, which I think is really key for queasiness, you do not want to let yourself get really hungry. So women will say, you know, I feel like I'm grazing all day, and grazing is fine during pregnancy, especially in the beginning when you just can't, stomach 3 big meals. So if you're going to graze and you're going to do small snacks, it's great to snack on cold cucumbers. They slide down, and then you're also getting hydration. There's also lots of watermelon, especially in the summertime, watermelon chunks that are nice and cold, and then the standard soda crackers, they work just fine. Or you can use saltines. So in terms of the pregnancy diet, we put a lot of emphasis on the important pieces of your diet, and lots and lots of data is coming out right now that it's not just about the weight gain in terms of pregnancy. Your baby really is what you eat. And so I think you'll find that whoever you're going to see, whether it be your midwife or your obstetrician or your high-risk obstetrician, Everybody is much more concerned about nutrition and exercise, much more concerned than we were in years past. And part of that comes because there's more and more data coming out that part of the reason we're seeing children early on, age 2 and 3, with obesity, with diabetes, even at these early ages, part of the reason we're seeing that is because there's something called in utero programming. So what the environment that you set for your baby in utero is really what's programming this baby's health from a very early age right through to the as the baby grows up. So it's important to put good stuff into your mouth. So not only is it important to get the right portion sizes so that you're not overeating or undereating, but it's also important to make sure that the calories that you are getting are nutrient rich. So this is just something that comes from MyPlate.gov, so you can go right online and take a look. It's important to have a range of things. Lots of color. The more color, the more likely you are to get the nutrients that you want. You want some dairy. You want some meats and beans and eggs. If you're a vegetarian, that's fine. Don't worry about it. You can definitely get the necessary protein through beans and eggs and nuts. It's good to have vegetables, just as your mother used to say. Fruits obviously are great. I would be careful of some of the fruits. I mean, you don't want to get fruits that are, total sugar. Apples are probably much better than 10 pieces of watermelon, but you can, sort of think about the choices. And then it's fine to have some carbohydrates, breads, cereals, rice, pasta. There's not a big problem with that. You just need to watch the portion size. You will find in the beginning of pregnancy, of course, that things like bread, pasta, rice, those things tend to go down and stay down quite nicely. Some of the better things that we want you eating, more vegetables and more meats and things don't set so well in the beginning of pregnancy. But the minute the nausea and vomiting or the nausea and queasiness is gone, you should then try and hop onto this great diet. So here's some sort of common questions. So decisions, you're thinking to yourself, well, how much caffeine can I have? There's lots out there about caffeine. So caffeine's no big deal. You can have some. You cannot have a lot of caffeine. So if you have a lot of caffeine, more than 200 milligrams of caffeine, the concern there is that it does increase your risk for miscarriage. In terms of alcohol, my rule and many providers' rule is no alcohol at all during pregnancy. I think you'll see some data. The British keep coming out with a study saying a little bit is okay. The bottom line with alcohol is that we don't really know how much for any given woman is okay. So if we can't tell you that X amount is okay, my feeling is 9 months is a very short period of time to abstain. Just skip it, and you can think about having something non-alcoholic. And then sushi is another one. It's good food. You just need to make sure that the sushi that you're getting is made well. So if there's any question in your mind, I'd skip it. The concern with sushi is, getting a parasite or something that's going to make you really sick. And then how much deli meat, unpasteurized cheeses, dairy products, hot dogs? So that's another, really common question, and I'm sure people are thinking, how on earth am I going to, have lunch every day and not, run to and get a sandwich? The issue with these foods are that there is a possibility, although not all that likely, there is a possibility that those foods can be contaminated with a bug called listeria. And listeria doesn't really harm you at any point in your life other than pregnancy. And actually the listeria may not make you all that sick, but the listeria can actually make your baby really sick and can sometimes cause fetal death. So that's why we say a big no to any deli meats or pasteurized cheeses, unpasteurized cheeses or hot dogs. So things like hard cheese, processed cheese, that's okay. It's the other stuff that we are concerned about. So you're going to have to say no to brie for a little while. And then how much fish? Well, this goes back to the mercury question. We don't want you to get excessive levels of mercury. So we say to limit your fish to, 12 ounces per week. So this is just a quick recap. Caffeine, less than 200 milligrams daily, no alcohol, beware of the sushi. I would really stay clear of the deli meats and things like that. Now the CDC says that you can heat them up. So if you want to reheat it so that it's hot, that may kill the listeria. And then the last thing is the fish. Again, it's 12 ounces per week, which is about 2 meals per week. And just so you know, if you're not pregnant yet, we suggest that you still stick by that 12 ounces per week the whole time that you're sort of childbearing age. So a little bit more about the whole vitamin situation. So is it necessary to take prenatal vitamins? Well, it's a little controversial these days. It depends on how good your diet is, right? So if your diet is excellent and you're getting all the right nutrients, you probably can get away with no prenatal vitamins. The vast majority of Americans, though, me included, don't have that great diet, in which case prenatal vitamins do fill in some of the gaps. So prenatal vitamins have some iron in it, definitely has folic acid. Folic acid, as you know, is really important for the developing fetus and developing the neural tube, which is basically the spinal cord, and making sure it is closed. So folic acid in the prenatal vitamins is about 800 micrograms a day. The minimum requirement is 400 micrograms a day. So lots of people taking just a 1 a day prior to pregnancy are getting what they need, and that's excellent. Prenatal vitamins also will have calcium, B complexes, vitamin A, vitamin D. More than your daily vitamin, that's also a common question. Some women want to take extra iron. That's fine if you're anemic. If you don't need it, don't take it. It will make you constipated. Taking extra folic acid and calcium, that's not unreasonable, and it certainly isn't going to harm you. Vitamin D is always great. Go ahead and take extra vitamin D. That's not a problem. What is a problem is you cannot take extra vitamin A. So be very careful that when you're doing herbal supplements and things like that, that you've asked your provider about whether or not those supplements are okay, because sometimes you just don't know what they're mixed with. Extra vitamin A is associated with birth defects, so don't go there. Omega-3 fatty acids, a lot of people say, oh, should I get that extra in my prenatal vitamin, and should I do this and do that? And you know, omega-3 fatty acids are really important for fetal development. Makes your kid a little bit smarter, and all sorts of great things. It's not 100% certain that you get the same effect from a pill as you would from eating fish. If you don't eat any fish, you might want to take the supplement. That said, I would try and get it naturally.
Laura, we have a couple of questions.
Sure.
One is, how much is the limit for vitamin D? Is there a maximum?
That's a great question. I don't think anybody knows if there's a maximum for vitamin D. It is a fat-soluble vitamin. You don't want to go overboard. But the vast majority of people, most data shows that lots of people are vitamin D deficient anyway if we were to check. So you probably are not going to overdose on vitamin D, especially if you live in New England. You know, a lot of us are not outdoors. And we slather on the sunscreen, which is important, but all of those things, you know, are going to make us, you know, a little vitamin D deficient. So it's probably not likely that you'll get excessive vitamin D.
And one other question, Dr. Riley. Are there foods to avoid, like nuts, that exposure in utero can predispose to allergies in the baby later on?
That's a great question. The American Academy of Allergy and Dermatology, I believe, has sort of looked at this. There isn't great data that suggests that women who eat nuts or avoid nuts are increasing the risk for their babies. So the current recommendation at the moment is that if you aren't a severely allergic person, there's no reason to cut out nuts from your diet. In fact, nuts are such a good source of protein that it's important that you not take out a major food, especially when the data doesn't support it. I suspect that there are some people who have so many allergies themselves and things like that, where they may want to have a separate conversation with their allergist, but for the most part, the experts are saying not to cut out a major important food.
Thank you.
So going on to sort of the ideal weight gain. So there are guidelines out there. It's amazing how many women don't follow them, and actually lots of providers don't follow them either, but it is important. And so this ideal weight gain during pregnancy is basically how much weight would be appropriate for you to gain to give you a nice average size 7.5, 8-pound baby. And this really is from beginning of pregnancy until the end. If your normal weight based on your body mass index, and you can figure out your body mass index is based on your height as well as your weight. And there's some complicated formula which I would never remember. I actually have a body mass index table in my book on page 431, or you can go online and then type in BMI, and you'll be able to calculate your body mass index. At any rate, based on that, what you are prior to pregnancy, then these are the guidelines. So if your normal weight prior to pregnancy, you really only need to gain 25 to 35 pounds. That's it. So when you gain 60 pounds, you have totally overdone it, and you've done yourself no good, and you haven't helped your baby either. If you're underweight prior to pregnancy, then you might want to gain more weight, and the recommendation is 28 to 40 pounds. And then if you're already overweight prior to pregnancy, depending on how high that body mass index is, if it's a little bit higher than it should be, more than 30, then the ideal weight gain is maybe 11 pounds, and the range is up to 20 pounds. But again, if you're overweight or underweight, you really should have that conversation with your provider so they can help you figure out where you should be, because it's a pretty big range. At the end of the day, the important piece is, again, it's not all about the weight. It's about the nutrients that you're taking in. It's about how you're programming your baby for its future. But I will also tell you that having a high weight gain, even if you start out normal and you gain 60 pounds, so you've totally overdone it, you've now increased your risk for all sorts of complications during pregnancy, including high blood pressure, gestational diabetes, getting a cesarean delivery, having a baby that is way too big to fit. There's a whole long list. So if you just try and stick with eating the diet that we've just talked about in portion sizes that are reasonable, I'm going to talk about exercise, that's going to help, and you stick with this weight gain guideline, you should be good to go. So where do all those pounds go? So women are thinking to themselves, good grief, that's a lot of weight. But if you think about it, there's a lot going on. So by the time you hit full term, and your baby, the average baby in the U.S. is around 7.5 to 8 pounds, and that's been stable for years now. There's extra blood volume. Your blood volume increases significantly during pregnancy and is probably 2 times what you're expecting by about 20 weeks of gestation, so it's quite a bit. Your breasts add a couple pounds. Your uterus adds a few pounds. Your uterus itself, which is a very big muscle, it gets much thicker during pregnancy and obviously grows. The baby is obviously taking up some space, and then there's the placenta, and that's what's feeding the baby. In this picture, you can see the baby. This is the cord and the placenta off to the side. This baby is nicely engaged in the pelvis. And then the baby is floating in water, so there's all that amniotic fluid in that, and depending on how much you have, that weighs some also. And then there's also, you will, in addition to all of that, gain more fat and other nutrients that you'll carry in your hips and everywhere else that you don't want it. And then many women, actually I should say most women, will retain some extra water, and usually it's sort of floating down toward your legs and your feet toward the end of pregnancy. Now this is looking at the tail end of pregnancy. This isn't what's going to happen right away. So all of this happens gradually with time. So
Dr. Riley, sorry to interrupt.
Yep.
Another quick question. The question is, how much weight should we gain each trimester or each month?
Oh, it's a great question. I think for most people, just a gradual weight gain over the course of the pregnancy. I try not to, I tell patients anyway, don't focus so much every single week of gaining 2 pounds or 6 pounds per month, or it becomes a little, it makes you too neurotic, I think. But in addition to that, it's going to vary depending on how you feel. You know, a lot of women feeling in the first trimester, it is just, you know, going near some of those foods is just not going to happen. So you may not gain anything in the beginning, and that's okay. Your baby doesn't need, you know, lots of pounds in the beginning. And then you may come back and you hop on the scale and, oh my goodness, you've gained 6 pounds. It's not the end of the world. Just know that the baby is gaining its greatest weight gain is between 22 and 32 weeks. So a lot of women will see big jumps at that point, and then they'll sort of slow down. I think it's much more important to focus on what you're eating, how much of it you're eating, and the fact that you're getting exercise, and that's all you need to think about. And that generally, if you just focus on those things, that'll get you right into that right weight gain time. And then, of course, if you're concerned about it, if you're really worried, gee, I haven't gained any weight, ask your provider what they think, and they'll tell you. They'll give you their opinion, no problem.
Thank you.
Can we go on to our quiz?
Yes, sounds good.
All right. So these are very easy, but it's amazing how much misconception there is out there. So exercise in pregnancy is safe 30 minutes a day. Yes or no? Looks pretty good. Of the participants we have, everybody agrees. The answer is yes, which is awesome. You should not get your heart rate over 140 beats per minute. Okay, so it looks like we've got some people thinking no and some people thinking yes. And so here's the real deal about that. So the keeping your heart rate less than 140 or less than 135, I think is what it used to be years ago, is actually old data. And it's not, we don't go by that anymore. You can get your heart rate up to wherever you need your heart rate to be to burn some calories and to get a good cardiovascular workout. That said, the best way of figuring out are you overdoing it is you should never be exerting yourself so much that you can't talk through your exercise. So if you're walking on the treadmill or you're hiking a hill or you're swimming a million laps and you get out of that pool and you can't even catch your breath, you've overdone it. So in general, you want to work up a sweat, and that may, for some women that's going to be 150 beats a minute, and for others it's going to be 160. If you're in really good shape, it's going to be a lot lower than that. But you do want to get some cardiovascular exercise. You do want to keep your muscles toned. You want to keep your back nice and supple so that you're not having so much low back pain during pregnancy. And for most people, that will mean that your heart rate will go up over 140 beats per minute, and that's A-okay. You're not harming yourself, and you're not harming your baby in that process. Getting to the end of the questions. Exercise reduces stress and improves your mood, I should say, during pregnancy. Yep. Awesome. So it looks like everybody agrees that exercise definitely reduces stress and improves your mood. It's awesome to get outside. You can't beat it. There's so many benefits to exercise. I think that if you're not an exerciser before pregnancy, pregnancy is probably not the time that you should join the gym and start doing extreme things. Yes, we want you to exercise, but you don't need to do anything crazy. So if you're not an exerciser, if you're just one of those people who just never got that together, I actually am a firm believer that walking is awesome, and I even have what I call is a walking program that has been tested in pregnant and non-pregnant women, and it's on page 82 of my book. And basically what you do is you just sort of gradually increase your exercise so that you can, get up to 30 minutes a day, and it definitely is well worth your time. So lying on your back, usually exercising, will cause decreased oxygen to your baby. It looks like we're sort of split on this one, and that's probably a fair split. So here's really the deal with lying on your back during pregnancy. If you're 8 or 12 weeks gestation, or even 18 weeks gestation, and you're lying flat on your back, you're fine. Your uterus is not that huge at that point. You're not going to feel sick. Your uterus is not so heavy that it's cutting off oxygen supply to the baby. That is not what's happening. I can tell you, though, as the pregnancy progresses, what can happen is when you hit 33, 32 weeks, your uterus is huge at that point, and it probably is sitting on the inferior vena cava, which is a really large blood vessel which brings blood from your legs and lower body up into your heart and also into your brain. And so when you are blocking off those big blood vessels that are bringing oxygen up into your brain, then you start to feel a little bit nauseous, a little bit lightheaded, and some women will just naturally, which is reasonable, just roll onto their side. So in general, as your uterus gets bigger, it's not that you're cutting off oxygen to your baby. As your uterus gets bigger, you're just not going to feel that great because you're kind of cutting off maybe a little bit of oxygen to yourself. You should just be on your side. So you don't have to be completely off on your side. In fact, when we do a cesarean delivery, we just put like a little wedge underneath your hip, and we roll that uterus off of the big blood vessels so that we can improve the blood supply. So that's what you want to do as you get certainly into the third trimester of pregnancy if you're going to continue to do your exercise. But the other thing is remember, there's tons of different things that you can do in most exercise classes that allow you to fully participate without lying flat on your back. So, every yoga instructor can give you all of the different changes, and, cardiovascular exercise teachers who are any good will give you all of the exercises that you can do that can be modified for pregnancy so that you feel good and so that you are comfortable that you're doing everything that's important for your baby. Favorite exercises during pregnancy? Well, I actually think I already gave this one away. So this might be a really easy one. So I'll tell you why I think that they're favorite exercises, as everyone else would agree. Walking, I think, just gets you outside. It gets everything moving. It's good cardiovascular exercise, especially if you can do some walking up hills and things like that. And it's easy to do. Doesn't take a lot of time. Nothing fancy. Don't have to worry about tripping and breaking your neck if you're not if you're not one of those people who's right on the money in terms of your coordination. Swimming is awesome if you have the ability to get into a pool. And the reason that swimming is great is because a lot of women will have, as pregnancy progresses, increasing low back pain. And actually, a lot of women will have it in the first trimester. It's probably a little bit different reason that you have it in the first trimester. In the first trimester, women who complain of low back pain very frequently have what's called sacroiliitis. They have a little bit of inflammation right around their tailbone. And that's because the hormones of pregnancy make those ligaments much more lax. And so you get more laxity in that joint that normally isn't so lax, and it can increase your discomfort. It's easily helped with Tylenol, with ice, and also, ultimately with some exercise, believe it or not. So swimming is really nice. It takes the pressure off your low back. And certainly as the pregnancy progresses and the uterus gets bigger and you stand more like a duck, swimming will make you feel absolutely fabulous. I think that's it for that little quiz. And so here we go, just as a recap for our quiz. I'm going to move on from that And then some of the things that I've told you already about caffeine and sort of excessive caffeine, things you just want to stay clear of. Again, I'm going to reiterate, no alcohol. I think it's just not worth the unknown. What might be a little okay for one lady is not okay for the next, so skip it all. Smoking, okay. Got to say it over and over again. You cannot smoke during pregnancy. If you smoke, put the cigarette down and don't do it again. It's really a difficult thing to kick, but by all means, ask your provider if you need help to quit smoking, because there are so many different smoking cessation programs that it's well worth taking the time and the energy to quit smoking. If you can quit before you're pregnant, that's even more awesome. But of course, if you can't, try and quit as early in pregnancy as possible. Smoking is associated with so many horrible things during pregnancy. Growth restriction for the baby. It really severely affects the placenta. So if you're worried about oxygen to your baby, don't smoke. Smoking also can cause the placenta to separate early, which is an absolute disaster. It's also known as abruption. That can cause the baby to die in utero. In addition, smoking is definitely associated with sudden infant death syndrome. So you get through the whole pregnancy, you have this beautiful baby, and then something horrible happens later. So it's really important to quit smoking. And secondhand smoke isn't great for babies either. So if you finally quit, you got to get everybody else in the family who's going to be around that baby to quit. And then illicit drugs, absolutely none. Nothing is okay. You don't want to try marijuana or try cocaine or do any of that kind of stuff during pregnancy, particularly things like cocaine. It constricts blood vessels and can affect the placenta and, again, decrease the baby's oxygen. So be really careful with those things. And if you have a problem with drugs or a problem with smoking or a problem with alcohol, please do speak up. That's why we're providers. Our job is to help you have a healthy pregnancy. And so a healthy mom is a healthy baby. Over-the-counter drugs, well, the deal there is that you need to ask, right? So always ask first. And at the end of the day, many, many, many drugs, in fact, most drugs, if you are one of those people who looks up on the internet, oh, is it safe? Most drugs are going to be classified as a C. The FDA gives classifications. And C means there's no good data, really. There are no randomized controlled trials done in pregnancy to tell us it's safe or not safe. So we tend not to use that information. Certainly obstetricians don't use it, and I know midwives don't use it. Basically what we do is we use information from large databases of pregnant women who have been exposed to these drugs. And then it really becomes, is the benefit of the drug so great that it outweighs some of the risks that are unknown, because it's almost always a bit of an unknown risk. So that's a question that needs to be asked about every single drug you put in your mouth. But always ask your provider first, because a lot of times they have a little bit of inside information which can help you make a decision. All righty, we're getting to the end. So a day at the spa, absolutely. I'm a huge spa fan. I think, certainly pregnancy massages can be done. They're very relaxing. As the pregnancy progresses, they can get you into the best position. They can put a little something under your hips so that you're not worried about compressing the vena cava. They have, special tables so that your belly is not, compressed. So by all means, sign up for that pregnancy massage if you have the means. Aromatherapy is fabulous. It helps set the mood, and it certainly is very calming for most women. There's nothing to be concerned about. The one thing is you do need to skip the hot tub, the saunas, the steam rooms. You don't want to increase your body temperature too high. And here's the reason. If your body temperature is high up at like 102, then the baby is even higher than that, because remember, the baby's in water. It can't sweat. It can't dissipate its heat. So that's not a good thing. And there is some data that certainly in the first trimester that high heat from saunas and steam rooms and things could be associated with birth defects. So just stay clear of those rooms. Painting your nails and toes, everybody worries about it, but you know what? As long as the ventilation's okay, you're going to be fine. Bikini waxing, sure, go ahead if that's what you like to do. I always suggest take some Tylenol or something because remember, the blood vessels are going to be huge down there, and so in which case, especially if you're doing the Brazilian or something like that, that is really going to ouch during pregnancy. And then finally, I think this is always important to most women, can I dye my hair? Can I straighten my hair? All those good things. If you're really wigged out about it, then use a vegetable dye. But you know what? There's really no data that suggests that hair dye, hair straighteners, things like that, adversely affect pregnancy or the baby. Most of that stuff doesn't really get absorbed into your skin all that much, so I wouldn't worry about it. Go ahead and try and look beautiful. That in and of itself will make you feel good. So in terms of the providers, so I talked a little bit about this, asking your OB, your OBGYN. It could be an MFM specialist if you have a high-risk pregnancy, your certified nurse midwife. There's lots of, family practitioners. Boston doesn't have as many as other places, but, that's definitely a place to go for prenatal care. Nurse midwives. There are perinatal nurses and perinatal social workers and dietitians and lactation specialists. All these people can, in the course of pregnancy, be very, very helpful to you for specific reasons. And you may not need all of them. Certainly not everybody needs to see a dietitian, but some people will benefit from that conversation and learn about, new things to eat or things to avoid. Your weight skyrocketing in the middle of pregnancy and you can't figure out what's going on. It's great to sit down with a dietitian. Write down what you've eaten for 3 days, go in and see a dietitian and see if you can get some pointers. Lactation specialists, I can't say enough about them. I think they're fabulous. They can be so helpful at the tail end of pregnancy when you're sort of running through what's going to happen with breastfeeding and things like that. And all of those things, you'll get more information as you attend the classes at ISIS, I'm sure. And who are all of those providers? Well, they're at different places, right? So it largely depends on where you're going to deliver. And some people go to large teaching hospitals, which is where I'm at. Most high-risk obstetricians are at teaching hospitals because we're associated with high-level nurseries. You can go to a birthing center if everything's anticipated to be normal, no reason to do all the high-tech stuff. Community hospitals, it depends, where do you live and, what kind of birth do you want. And, there are some people who want to deliver at home. I have my issues with that, but you know what? If you're low risk and you're well counseled and you have the right person attending your birth, that might be the right experience for you. So what happens when you get prenatal care, which I'm a huge advocate of? I think everybody should see somebody in the course of pregnancy to head off things if we can. That first visit is usually, depending on where you go, usually between 6 to 10 weeks gestation, and usually that's when we sit you down and ask you 10 trillion questions about your history, your family history, your partner's history, do a physical exam head to toe, and then we do lab work, and we check your blood type, we check for hepatitis B, we also do a syphilis test, an HIV test, chlamydia. We want to make sure you don't have any infections that could adversely affect your pregnancy. If you haven't had a pap smear recently, it's a great time to get that done. And then, the funny thing is that at that first visit, what most women want to know is, I don't feel great, but I really need you to tell me that I'm pregnant and that there's a reason for why I don't feel great. Depending on when you come in, sometimes we can't tell that, definitely. Usually we can tell based on your pelvic exam. Your uterus is bigger when you're pregnant, and your cervix is a little bit softer and has a little funny color to it. In addition, most women have much more vaginal discharge than they ever had before, and it's described as like sort of a creamy white thing. So all of those things are clues that you're pregnant and things are going in the right direction. If you're around 10 to 12 weeks or so, we can actually listen with a thing called a Doppler, and we can hear the baby's fetal heart. If we can't hear it and there's some suspicion that there could be a problem, if you've had multiple miscarriages or you've had some bleeding before you came into the office or things like that, sometimes we'll go ahead and get an ultrasound even that day, but not always. If things are good, there's no reason to do it. But that's, sort of a discussion that you might have with your provider. And then the visits are generally monthly until about 28 weeks, and then in the third trimester the visits become a little bit more frequent because things are happening at that point. Another important thing to sort of go through real quickly is sort of what are your prenatal screening options. So, people are concerned about the health of their baby, and many people are concerned about whether or not there's a chromosomal abnormality. I'm just going to quickly put this up, but this is really one that you need to spend some time talking to your provider about, because lots of things are available, and it seems like there's something new every day. So first trimester screening, so around 11 to 14-week gestation, you can have an ultrasound and blood work that can give you an idea of whether the baby has a higher or lower risk of Down syndrome, trisomy 13 or 18. A quad screen can be done if you don't want the first trimester screening. Some people will just do the blood work. Second trimester ultrasound can sometimes be helpful. It's not a great diagnosis for chromosomal abnormalities, but certainly that ultrasound is important to show whether or not there are birth defects. A new test that's out on the market, something that you should ask your provider about, is something called cell-free fetal DNA testing. And that's a blood test, so it's non-invasive, no needles being stuck into the uterus. That's a blood test which can, with fairly good assurance, tell you whether or not there's a high or low risk of the baby having Down syndrome. And that test is probably, in the coming months, actually even be extended to trisomy 13 and 18. Definitive pregnancy tests, so prenatal tests. So if one of those screening tests that I just mentioned to you comes back and says, oh, gee, this baby has a high risk of, say, trisomy 13, and you're all concerned, then you can do what's called definitive tests. So those tend to be invasive. Chorionic villus sampling or amniocentesis. And I'm just going to show you quickly on the next one. The reason they're invasive is because they involve something being put into the uterine cavity, and that in and of itself can increase the risk for miscarriage. Now, amniocentesis is done later. The risk of miscarriage with an amnio is around 1 in 5 to 600. With a CVS, chorionic villus sampling, it's around 1 in 100, but it's done earlier in pregnancy. Those are definitely longer conversations with your provider, but definitely important ones. And so, as the journey continues into your second trimester, most women are cruising along now. The nausea starts to get better. Their energy reemerges around 17 weeks gestation, and then you get that big ultrasound, and everybody is all excited. They're really, we're looking to make sure there's no birth defects. You, of course, are looking for the sex many times. But we're looking at the fetal survey. We're doing, basically, we're trying to locate the placenta. We want to know if there's enough amniotic fluid. We're looking at the baby's profile to make sure that there's nothing else going on. There's lots of information. We're looking at your cervix. There's lots of information that's gained from that 18-week scan. And then this is important. There's lots of aches and pains during pregnancy. Most of them are fleeting. Lots of them are gas. But some of them are important, and you need to know when to call your provider. So if you have any bleeding or spotting during pregnancy, until it's evaluated, it's not normal. Just call. If you have abdominal pain that's getting worse and worse and stronger and it's unrelenting, we don't know what's going on. You need to get on the phone and you need to ask questions. Fever, vomiting, urinary tract infection kind of symptoms, frequency, urgency, it's just really hurting. All those things are important to call. And then the other one that I put on here, it's important, is if your emotions are just really out of control and you're not sure what's going on, you're depressed or you're really anxious, then just call somebody and ask them. I mean, it may be okay, but then again, there may be something we can do to help you. So, don't be afraid to speak up. And then a little more about the emotions. Pregnancy is fabulous. It's a joyous kind of occasion, but it's also anxiety-provoking. And for people who have a pre-existing, history of depression or anxiety, you're in a situation with chronic or acute stress, you need to really speak up. And there's lots and lots of resources. There's some things you can do for yourself. There's other things that we can suggest for you. But it doesn't, just because you say something doesn't mean that you're going to need a medication. So don't be afraid to speak up. And I'm getting to the end. The life changes. So there's bed rest. How much does it really make a difference? That's the question you need to ask your provider, because really there's no data to suggest bed rest helps anything. Travel, sure, get out of town, but make sure that you understand that pregnancy, because of the hormones, the high levels of estrogen, it does increase your risk for getting a blood clot. So it's important to take some precautions like hydrating and walking around and things like that. And sex, no problem. No reason to ruin your sex life over pregnancy. The only reason to refrain really is if there's something going on, your provider will let you know that. Prenatal visits, we already covered this. They're going to be spaced, they're going to be a little closer in the third trimester. Lots of things to do. We're watching for different things. Every visit is really, what's going on with you? How are you feeling? Is your baby moving? Are you having contractions? We'll get a general idea how big your baby is, and we'll check your urine for protein, because that's one of the determinants of something called preeclampsia. So here's again, this is what we're hoping to get to. Most people do. And I think that we're done. So there's maybe a minute or two for questions. Chris, what do you think?
Well, it looks like everyone presented questions during the presentation. So I wanted to thank you for all this wonderful information. And now that we've come to the end of our presentation, I want to remind everyone to check their email for the presentation recording, which we'll send out within about 2 days. So Dr. Riley, I really want to thank you so much for sharing all of this great information with our audience tonight. And thanks to everyone for attending. We hope to see you at another ISIS online event soon. Good night, everyone.
My pleasure. Good night. Happy summer.